make sure they're relatively squared up. I need to scoot this way just a little bit. Okay, there we go. Leg a bit further back. Her hip flexors are tight, so that's already.
I was like, why is this uncomfortable?
And that right there assessment. It felt, I can tell that this is already tight here. Okay. Now, what we're going to be assessing is just pretty much going to be glutes versus low back. Okay, the muscles here that are talked about are, we go surface to deep, we have our external oblique, internal oblique, transverse abdominis, and then finally we're to quadratus lumborum. Quadratus lumborum is real deep. I'm gonna stand over here so that you guys can see. But what I'm palpating for is greater trochanter. Wow. Greater trochanter, just superior to it, that's gluteus medius. Yep. And it might feel kind of ropey, not like a, but you know, usually it feels like there's kind of a, depends on the person. Then we're finding the iliac crest, the top of the pelvis, and then it's the same place we've been putting our forearms, right? But now we're going to be palpating and assessing, because it's better for me to be here. As a person lifts their leg, now this doesn't have to be big. You could remove the bolster and have them do a bigger action. But, so I can prepare you for people that maybe are weaker or anything like that, more frail. It can just be, can you lift your leg up off the bolster? It doesn't have to be big. Back down. Okay, lift it up. That already was a test. Okay, good. Now, let's get our hands on the muscles involved. Greater trochanter, superior to that, gluteus medius. Iliac crest, superior to that. The obliques / quadratus lumborum. But boy, would you have to dent that to make sure you're on quadratus lumborum. So you gotta put some pressure here, okay? And then really slow, lift your leg. Oh, low back, back down. Okay. Gluteus medius and minimus are very trigger pointy.
Yes.
Yeah, yeah. And
I'm like, yeah, that's there.
good balance.
Yeah.
All right. Now, how'd she test?
Okay, yeah.
Everybody did low back first. Right. Now, how do we fix this? We have to tell something no. And then we're also thinking about what we're not pushing on. So we're going to push on. This is the method to the madness of saying, find the top of the iliac crest and drop your elbow straight down. That's why I try to make you do that from the get-go. Here, iliac crest, drop your forearm straight down. You could potentially assess this with forearm and hands. You just have to kind of reach across like this. Go ahead and switch your arm. The only reason why I do that is because if you go this way, it's not necessarily wrong if you're really careful, but you could inadvertently get into that floating rib. So this keeps you aimed at the pelvis. And if you reach over your own arm, you could still palpate that. But really, all we need to care about is when they do the action, we're inhibiting the lumbar area. Okay, slow lift. Good.
Go ahead.
And slowly down. Good. A little bit again.
I feel like it's still using it. Yeah.
Good. And back down.
It doesn't
Now,
care that your arm is there.
Doesn't have to be a lot, but hold. So if it is being resistant, make sure you're holding the contraction longer. So encourage people to hold. Doesn't have to be a big movement, but they should hold that contraction for closer to 10 seconds, ideally. So lift, hold for a while, and do a full 10 seconds. And then you gotta go for a fun countdown, like 8, 7, 6. It's much longer than you think. All right, then slowly back down. You're trying to kind of fatigue it.
You okay?
Yeah.
Is it too much? Is that intense?
Sorry.
No, that's fine.
Yeah. Okay, a
It's
little
just
bit
holding
again.
it.
The workout. I'll give you a break for a second.
And back down. It's the weird thing where, you know, all the literature and the research is showing the longer contractions are what produce the better results. Most of the time, everybody's patience is closer to 4 or 5 seconds.
Yeah.
In all honesty, it's usually closer to 5 where I like it's good enough. So there's that one. If it's comfortable, we can leave the bolsters there for now because we're just moving on to the next piece. Test this again real quick. Sorry. Let's see if we got any improvement.
No, you can leave it.
A little lift. It's at least co-contracting. I'll call that a win. Now consider, even if you made it,
That's good.
but let's say you went from a 80% to 20% ratio to a 60-40. All right, you palpation-wise might not get a perception of change, but you are still making it maybe more efficient. So
It might take
Yeah,
more than
I think-
one.
Yeah, I think you're right.
afternoon.
that's where you got to
It's not
sprinkle it
lower.
in.
Fix one
Yeah.
first.
It's where these things, you can see now this one integrates less easily into your traditional sessions because of the nature of moving that bolster, okay? Now you could do it without the bolster. Nothing wrong with doing that. You just take the bolster out, you have the leg down like this. It's just the person's a bit more tippy and you can come in and you could do it like that. So you could do it at the end of the session, end of the cycle, all that. My personal tendency has been, now that I'm saying it, I might as well do it. My personal tendency has been to keep the legs like this. And that's where I've used the inhibit here and have them activate this leg. But that's just a muscle energy technique. That's not about firing patterns. I would go to the firing pattern stuff when I saw people having balance issues and gait issues. But if it's just low back stuff and I needed to come in with another muscle energy technique, then this is the one. Inhibitory pressure, plus an active movement of now the opposite leg. So lift. This is just creating a co-contraction from one side adductors to contralateral abductor/lateral flexors. Back down. As a muscle energy technique, both work great, but one is more about firing patterns, one is just a muscle energy technique. And that one apparently felt like it did more, huh?
It did.
So, and this is the left side.
Yeah.
So let me balance you out a little bit. Pressure. Okay, right there. Okay, you want to lift that bottom leg. I find too this is incredibly easy for most people compared to the other. Okay, slowly back down. We've already done this one a couple of times. And then again. One more time. And back down. Now, if you're not getting the results you need, then you should remember to check out the other option, okay? Now for shoulder abduction. We're going to teach the person the action that we're looking for. This is why during the repositioning of this, it's smart to be getting the sheet tucked in such a way and get that arm over on top of the sheet and just get used to that being part of your routine so that you already have it there ready to go for either, you know, the massage piece goes back towards me a little bit. So even if it's just the massage piece, all this stuff, it's just going to be convenient for me to pull all that off, right? But that's why you want that arm out and then either the blanket on top of it or a towel on top of it to keep it cozy. And the action is going to be shoulder abduction. So you're going to be bringing your arm up that way. That's the action we're looking for. I find it easier if I can to do the passive movement for the person and say, this is what I want you to do. All right. Now what we're palpating for is going to be intermedial deltoid and upper trapezius. So with deltoid, it's easy because right here, right in the middle. Now deltoid's bigger than you think. Comes probably down about a full hand's breadth. So I want to be about here. Don't be up here on the bone. There's not much muscle there. So here. Okay. Upper trapezius should be, everybody should have a good sense of where upper trapezius is. That's where everybody wants you to massage more on their shoulders, right? Not that one, I know. So, but palpation, upper trap, intermedial delt, and then they just lift their arm up off the side. Back down. Doesn't have to be big. Again, little lift. Good. Back down. And again. And I already got better. So it was trap first for her. We had a.
It was her. They were deltoid first.
Good. Great.
Yeah,
How are we doing over there?
for once the traps aren't doing everything.
Upper trapezius first. So now, in the event that this is wrong, then what are we going to have? What are we going to do? Let me roll you just a little bit. Okay. Inhibitory pressure plus movement. So that's using a soft fist. It's easier for me if I bring in the forearm because then my hand can come over more like this. So now, a really good muscle energy technique for reducing the tone of upper trap. This may or may not be part of the issue, but this is an easy action to incorporate when you're talking about shoulder-related dysfunction, okay? But the other one is the one that I've shown you before of the shoulder shrug. So they just shrug their shoulder up against you. That's going to be scapular elevation versus reaching for their toes, scapular depression. Now, one is a firing pattern thing, talking about how upper trapezius should fire last, secondary to deltoid. The shoulder shrug is not about the ball and socket joint, it's about the scapula. It's about scapular elevation and depression, which upper trapezius and that lower trapezius. And I mentioned that before, where upper trapezius shortens when you elevate your shoulder, and lower trapezius shortens when you depress the shoulder. More often than not, wing scapula people, we need more tone here. We have too much tone here. Relax. And it's just a really common thing, especially when you look at the asymmetry. Everybody was really good with postural assessment of finding that shoulder was too higher, right? Okay. So pretty easy to sprinkle both of these in to your applications of here. One could be about firing pattern. If it's a rotator cuff thing, if it's about abduction, then I know the motion to do. But if I've seen a shoulder that's elevated and there's discomfort, but the range of motion, at least to 90 degrees, is pretty efficient, then it's about the scapula. So then what I should go to is the muscle energy technique for elevation depression, which all that has to be is inhibitory pressure of upper trapezius, elevation, so shrug your shoulder up. I'm telling upper trapezius to lengthen mechanically while it shortens, and now go ahead and relax and then reach for your toes. Now she is shortening lower trapezius while I compress and lengthen upper trapezius. And relax. And shrug. And reach. And just look how easy that is for me, because I just have to coach them what to do. Okay, good. Let go. Those two will take you far. All right, to balance the person out, let's flip on the other side and just go through that pattern real quick again. Straight leg.
Weird. Can't do that. Sorry.
Hip flexors a little tight.
No, it's just awkward.
Yeah,
It just feels
a little tippy. No, it's never the more comfortable spot. So that's why, you know, I've never done a massage with a person set up like this. It's only been for this. So, yeah, that's why I try to be realistic about the reasoning why sometimes it's used less. Okay. All right. Oh, finding, grabbing a better one?
Yeah.
Bravo.
Gave up.
No, that's okay, that's smart.
And your message up in this.
All right. So, just going to confirm they do the action. They know the action we're looking for. Lifting your legs slowly up, just a little bit. Great. Back down. Excellent. Okay. Then I'm going to do it sneaky. I'm already going to place my forearm in the low back, reach over my forearm, find the greater trochanter, go just superior to it, And then I'm not gonna apply a lot of pressure with my forearm. I'm not looking for that, could hurt or anything. Just enough to be denting those obliques, maybe getting to QL. Okay, lift your leg, nice and slow. Okay, move that back down. Okay, slow it down real slow. Okay, good, back down. Kind of a co-contraction. Relax. Now I'm gonna apply more pressure to the point of kind of to that therapeutic edge, so to tolerance. That's just right.
Yeah.
Okay. A little lift. Good. Back down, nice and easy. And again. And down, nice and slow. And again. I have a personal thing with regarding coaching a person to control the deacceleration,
Yeah.
to control the lengthening, okay? Rather than just telling a person to relax or let go. I'm really
Yeah, people all just,
drop their leg. And we want to teach muscles to be more efficient in both categories. And there's 3 categories of concentric, isometric, eccentric. I want to teach them to be more efficient at eccentric lengthening. Our muscles are very good, usually too good, at concentric shortening. So, telling a person to control the relaxation or to move into the stretch, both of those are encouraging more efficient eccentric lengthening and function. Okay? All right, to our shoulders. Here's where I could just do a palpation like this, or I could get myself set up, feeling with my forearm, feeling with my hand, and saying, all right, just start to lift your arm up. Good, and this one fired much better. Good, a lift. Excellent. Now I've confirmed that that's firing pretty good. So I'm just gonna go right into the shoulder elevation depression piece. Okay, shrug your shoulder
Pretty even.
and reach for your toes. Okay, shrug your shoulder. Reach for your toes. And shrug. And reach.
Okay, now this is firing first.
Good, let go.
Yeah. Yeah.
This is where you can just be thinking,
To me, it feels like they're firing at the same time.
and that's why,
It's hard to feel.
in
It's like firing.
worst case scenario, fix it anyway. Fix it even, if you don't know, like if you get like 2 or 3 movements and then roll with it. And if it, I usually just fix it again anyway. I'm right there to do it, so I might as well encourage it to stay that way. But I might just do 2 movements plus the inhibitory pressure rather than like 4 or 5. So, all right. If we feel like we balanced our people out, let's go to supine.